Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So this episode, as promised, is part 2 of a conversation I'm having with Associate Professor Annemarie Lee from Monash University Physiotherapy. And in part 1 of this conversation, in the previous episode, Annemarie and I were talking about bronchiectasis, background, what it is, specifically about airway clearance techniques. And then we talked about some website resources that Annemarie and colleagues have developed for bronchiectasis, and some really interesting links between the condition and other health conditions. So it's not an episode only for cardiorespiratory physiotherapists. It really is an episode for all health professionals. You may find it interesting if you're a patient or a person with these conditions, but it is a podcast aimed at health professionals and health professional students. So obviously take the advice of your own health professional in your healthcare. And if you do want to hear a bit about Annemarie, who she is, go back and listen to part 1, and it's all in there. So let's kick off where we ended last time, Annemarie. Welcome back to Physio Foundations.
Thanks, Luke.
Let's talk about exercise. We know it from the previous episode. We know what bronchiectasis is. We know who it affects. We know the symptoms, the impact on the person. You talked about airway clearance techniques in some detail. And we talked about why you'd be doing these techniques, how they could help with those symptoms and exercise tolerance. Really good summary. And then we left exercise for this part. So how does exercise benefit people with bronchiectasis? And let's talk about the physiological benefits and the mechanisms as well.
So based on the information that we have from different studies, we know that exercise can certainly help to reduce someone's breathlessness levels and also their fatigue. It can improve their muscle strength, improve their exercise capacity, and also their quality of life. And there's been one study that shows that it can reduce the frequency of exacerbations over a 1-year period. That's when it's done sort of for what we call fitness purposes. So in that context, you're looking at a pulmonary rehab program where the exercise prescription is designed around addressing cardiovascular and cardiorespiratory limitations. It might also have some benefit for airway clearance, but it hasn't been specifically looked at in this patient population. So we know that when we look at other patients with cystic fibrosis, for example, that exercise certainly can be helpful in terms of clearing their secretions. And we know that some people with bronchiectasis are certainly using exercise for this purpose. But the physiological benefit of that is something that is still unknown, and we need to get that information. And in my opinion, that's a priority to actually sort of be able to understand that in a lot more detail so we can get a much clearer idea about the benefits and the role of exercise for its different purposes.
So a research priority.
Yeah. Yep, absolutely.
Yeah. Which can then feed into the knowledge base and feed into those clinical practice guidelines and then eventually become a more common part of clinical practice, which is why we don't do research for the sake of research. Hopefully, we're doing it for that reason.
Absolutely. And exercise in itself and pulmonary rehab is recommended in the national and international guidelines for bronchiectasis, but we don't have any specific studies talking about exercise outside of the pulmonary rehab context. So, and that's the area that we know a lot of people are doing exercise as part of their management plan, but we don't have a good understanding of what they perceive are the benefits.
What's a typical pulmonary rehab class look like? Just to define, just for those who may not have taken one.
Yeah, so in Australia, this typically runs for an 8-week period of time. Usually people are doing their exercise at least twice a week, if not 3 times, and they'd be set up with a home exercise program to complement that. And it might be done in what we call centre-based rehabilitation, so attending a hospital outpatient or community health centre or rehab centre, or it might be done at home or through telehealth or using a mobile application. So The COVID pandemic certainly expanded a lot of the options for delivering pulmonary rehab across the board, and that certainly applies for people with bronchiectasis as well. And a typical program would include exercise, so some endurance exercise, whether that be walking or cycling as a starting point, and then some different strengthening exercises for both the upper and lower limbs. And there's some different options in there to be able to sort of choose from for a particular sort of patient point of view. And some programs will also include an education component where people will be given some more detail and provided with some more direction to help with their self-management. And there's lots of different topics that might be included in that component of the program.
And your website resources could complement that as well. The bronchiectasis toolbox and strong lungs websites.
We certainly recommend that if it's suitable for people with bronchiectasis to get engaged in a pulmonary rehab program, and I can talk a little bit more about what might make someone suitable or not, then that is certainly something that could be considered sort of in clinical practice.
Well, why don't we do that now before we get more specific about airway clearance exercise? What's the suitability of someone with bronchiectasis for pulmonary rehab?
Yeah, generally what we find is that people tend to benefit most if they're experiencing some level of breathlessness when they're engaging in some form of activity. So the different studies that have been out there have had various different levels of what we call functional breathlessness, but they need to be experiencing some limitations to get benefit. So essentially, their baseline sort of exercise tolerance is lower than what it would be ideally for someone of the same age, height, weight, etc.
Otherwise, there's a ceiling effect there. It's too easy for them.
Yep. And the good thing about pulmonary rehab is that it does offer a supportive program. So you're engaged in some way, shape or form with other patients. So you might have quite a lot of engagement depending on the centre and how it's delivered to you, or it might be a little bit more limited, which could be the case for a home-based or a tele-rehab model. But they all have clinician support. So that really helps with not just prescribing the initial exercise, but also about advancing the exercise sort of prescription, progressing it, and dealing with the different challenges that might come when a patient's symptoms are certainly limiting their progression, or they're experiencing some challenges with specific sort of exercises. So it's a really sort of supported environment. And most programs also have what we call or recommend a maintenance or ongoing sort of exercise program after they complete an 8-week course to be able to keep up with lifelong sort of exercise, essentially. So you're looking at people who are, in terms of your inclusion criteria, someone who's got a reduced exercise tolerance, is breathless, and they need somewhere to start. And this is a good sort of starting point. And they also need the support to be able to motivate them and keep them sort of attending, essentially. They would struggle to do that sort of on their own. So it's often an older generation as well. Partly because of time and availability. So bronchiectasis can affect various different sort of ages. So younger people, younger adults in their 20s who are working full-time might find it actually really challenging to attend certain types or models of pulmonary rehabilitation. So they might be doing other forms of exercise instead. So that's got to be factored in terms of, are they available? Have they got the flexibility to be able to sort of attend and commit to that sort of 8-week, twice weekly type of program?
Would only people with bronchiectasis be in that program of pulmonary rehab, or is it a mixture of people?
It's highly likely to be a mixture. So COPD is probably the most dominant diagnosis, and we're also seeing more people with interstitial lung disease or pulmonary fibrosis. Bronchiectasis, asthma, pulmonary hypertension, lung cancer. It will depend on who's been sort of referred, essentially, and who broadly meets that inclusion criteria of they're experiencing breathlessness on exertion and their exercise tolerance is poor, and they actually sort of would benefit from that program.
And in our healthcare system, physiotherapists mainly provide or run the classes and do the measurements within them, or do other health professionals contribute?
That's a good question. I think it's predominantly physiotherapists, but we certainly know some programs are run by exercise physiologists or exercise scientists, depending on the program and who's available and who's employed. And certainly having expertise in exercise prescription or knowledge around exercise prescription, and also being able to understand, the nuances and the population that is coming through is important in terms of making sure each individual program is set up well for a patient.
It's good background information, because people are, okay, again, I'm taking this from somebody who's primarily come from a sports musculoskeletal background, and I'm teaching in those fields too. People come to your clinic with all sorts of comorbidities, and they may be at these programs. It's really good for us to understand what they involve as well. So pulmonary rehab, not just for people with bronchiectasis, but certainly for them as well. And we're considering that separately from exercise for airway clearance. So what's exercise specifically for airway clearance? We can look at your website resources and get some definitions there, but it's not necessarily happening in the pulmonary rehab class. It's just more general exercise tolerance, strengthening, aerobic, social support, education, etc. So how do they differ?
A good point, and it's complicated. So I think there's sort of, there's two questions there. There's the question around what people are doing for exercise for the purpose of airway clearance, and what people are doing for exercise for, essentially for fitness that is not a pulmonary rehab sort of program. So I might talk about that first, and that will lead me on into what they might be doing for airway clearance purposes. So essentially, in terms of those who aren't suitable or can't attend or not interested in attending a pulmonary rehab program for various different reasons, they might be engaged in other forms of exercise. So this could be walking, playing tennis, swimming, jogging, cycling, playing netball, going to the gym, doing their own sort of strength training. So we know that people with bronchiectasis are doing this. And we certainly know that that's the case for both children and adults. And I guess knowing that, we actually have a need to get a better understanding of what are their perceived benefits when they're doing the exercise in this sense. And is it because they feel that there's an improvement in their fitness levels, or do they actually notice that there's some improvement in terms of their airway clearance as well? And that's the unanswered question for this patient population that we've got at the moment. So certainly some people tell us that they are using these different forms of exercise to either complement their other airway clearance techniques, or doing it as the sole technique for clearing their secretions. But we really don't have a good understanding from the patient's perspective yet as to what do they notice are the benefits. So, are they noticing changes in terms of how much they're coughing, or how easy their clearance is, or are they noticing improvements in terms of their breathlessness levels, or having less fatigue from clearing the secretions when they're doing whatever form of exercise that they're choosing, and therefore what are their sort of perceived benefits? So a really unanswered but really important question that I consider to be sort of a priority for this patient population.
And why is it such a priority to understand that? People need to buy in and understand the benefits of what they're doing. We also need to understand the mechanisms of how exercise is helping, so we can double down on them if it is effective, and we understand how we're helping. Tell us a bit more. This is a non-curable disease, as you mentioned in episode 1. Tell us a bit more about airway clearance techniques and the mechanisms, and why it's a priority to understand this.
I think when we're specifically thinking about exercise as an airway clearance technique, the reason why it's a priority is that probably less than 20% of people with bronchiectasis actually either are referred or attend a pulmonary rehab program. So we've got 80% of the population who we don't actually know what they're doing, if they're doing anything, and if they are doing something, what are they doing, and what are the benefits of them actually sort of doing that. So we've got a huge gap, and therefore it's really hard as clinicians to be able to have specific sort of guidance in terms of when you're presented with a new patient and you're asking about their exercise and pulmonary rehab is not an option. Having some more sort of guidance in terms of, talking to them about sort of their exercise preferences, what will be feasible, viable, what's of interest to them, and what are the potential perceived benefits that other patients, their peers, have actually sort of noticed as well, is a really important thing to be able to get people on board, particularly if they're a bit hesitant to exercise. Or a bit embarrassed by their other symptoms and a bit worried about going to the gym because they tend to cough all the time. And people think they've got COVID, which is one of the common things that have come out sort of in the last few years.
Yeah.
Getting that information, I think it's really important to get that detail from the patient's perspective. We can put in a range of different measures that we're interested in, but we actually need to get their understanding sort of first of all to help guide that clinical practice for us. And that will enable us to be better clinicians, essentially.
Right. So there's huge research gaps.
Yep.
Potentially relating to funding gaps. We always need more money. Every field of research says that, but this is a really important field of research. And then, okay, if you're listening to this and you're if you're interested in being a researcher or getting involved in research in any capacity, this could be an incentive to get in contact with Annemarie and ask a bit more. So we're always looking for research, people who are engaged in research and research students. But back on topic, if we think about the exercise that's happening, most of the time people are doing their exercise for most of their life themselves, even if they do participate in 20% of people who are participating in a formal class that we know of. So how do people monitor and progress or regress their exercise and manage exacerbations? What are some of the things that you teach them to monitor and to know when it's time to go harder and do a bit more or to back off?
I think certainly one thing that's important to know is to when not to exercise. So if a person is brewing a chest infection or is certainly being diagnosed with a chest infection, then there's not a lot of benefit for exercise, including using exercise for the purpose of airway clearance therapy. They probably need to use another type of approach because the exercise is essentially just going to stress their system more, increase their temperature, increase their sort of fatigue levels and their ability to recover well. And because everything's sort of in a heightened state when they're acutely unwell is certainly going to be challenging and potentially sort of compromised.
Yeah.
So it's important that people know when not to exercise and what are some of the common symptoms that are associated with their exacerbations. And, some of the common ones might be an increase in the amount of phlegm or a change in the colour or the amount of phlegm or noticing that they're more breathless or a little bit more fatigued. But it has to be identified on an individual basis because not everyone is going to have the same symptoms. So having that conversation and providing that education is important. I think when someone's well and they're engaged in their exercise program, we certainly want to teach them to be working to a suitable level of breathlessness and fatigue that is going to get them benefit and continue to get them benefit. So this is where we use our resources and I guess our targets that we would apply for COPD. In terms of breathlessness, we would generally expect you to be between 3 and 4 on a 0 to 10 modified Borg scale. And in terms of fatigue, with the rating of perceived exertion scale, we would, in terms of being between 6 and 20, we would ideally like people to be between sort of 12 and 14. So feeling like they're working, but not feeling like they are then wiped out for 24 hours and can't do anything sort of the next day. So they should feel a little bit of fatigue, but that sort of should resolve itself. So certainly teaching them how to monitor their symptoms and also specific for bronchiectasis, looking at the ease of their ongoing airway clearance therapy. So especially if they're doing other techniques to be able to facilitate that. So have they still got the energy to be able to do that, or are their energy levels actually sort of increasing as a result of that sort of exercise? And I think the really important thing, and this is, I guess, a little bit separate to pulmonary rehab where we essentially, as a clinician, we do come in and assess the patients and we are guiding the progression. when someone is doing their own sort of exercise program, the only way that we can help provide them with some guidance is giving them regular reviews or offering that opportunity of a regular review. And when I say regular, it could be, depending on the clinical practice and the availability of both patient and clinician, it might be every 2 months or every 6 months or 12 months. But I think some form of review on a regular basis is important so that you can make changes. And the other component of that is giving patients both the flexibility and I guess the scope to have some choice. If they want to choose different exercises and they find that, different exercises actually sort of work for them and are of interest, to help them sort of navigate through that menu of options that might be suitable for them and give them the freedom to play around with it and say, okay, well, on this day you might go for a walk. And on this day, Friday, like one of my patients I've got at the moment, she cycles to her Pilates class, does Pilates, then cycles back home and goes for a swim afterwards. That's her exercise for the day, and that's essentially her airway clearance for the day. So giving patients that flexibility and that freedom to be able to sort of adapt, particularly when they're doing their own exercise sort of program, is really important. And hearing what they're telling us about what are the limitations. So if someone says, no, this exercise is actually getting way too hard, guiding them through ways that it could be sort of modified depending on how their condition might have changed, either on a temporary or a more permanent sort of basis as well.
So important. People are people. It's a human. It's a person. Everyone's different. And in the hospital system, it can be things can be very medicalized, often for a very good reason, because you need to strictly control things like infection. But giving that person that choice in how they manage their problems. A reflection here. This is not easy for people. This is kind of complex. It requires a lot of reflection and trial and error. And so then in the first episode, you mentioned language barriers for people from different cultures. Of course, there's different cognitive levels of decline in people who are older, perhaps. There's all sorts of factors that could make it really hard to stay on top of this for people. What are your thoughts? I don't have a good question there. What are your thoughts on that reflection, the complexity of it?
Yeah, I agree. It is very complex, and no one knows their condition better than them. And I think as a clinician, you have to really appreciate that. So, I learn the most, and I've learned the most in terms of bronchiectasis from my patients. And I know a number of other clinicians will actually sort of say that. But I think the key is when you're doing that initial assessment, that is so crucial to actually be able to get a good understanding of the patient themselves, not just of their symptoms, but of who they are and what are their priorities, what are the resources that they have or don't have, how much time do they have, what are their family commitments, what are their concerns about embarrassment with some of their symptoms, because all of that will certainly play a role in terms of the approach that you might take, whether it be for prescribing airway clearance or whether it be for prescribing exercise or helping them to manage their comorbidities or referring them on to someone else to manage their incontinence. So it's really, it's that listening and that active listening that's so crucial, and I think something that's fundamental to being a good physiotherapist, and being able to not just listen but to hear and then to sort of act on that sort of as well, and essentially develop that therapeutic relationship or alliance with the patient where you're both sort of working together, but everyone is providing different levels of sort of expertise and knowledge to get the best outcome sort of overall.
So good. You foreshadowed my unscripted, unplanned final question to surprise you with, which is, what do you think the most important foundational knowledge and skills are for physiotherapists or any health practitioner? And part of the answer may be active listening that you just said, understanding the person. But there's so many skills. You could say anything here, but what do you think are some of the most important skills for a health professional?
Apart from the ones that you've mentioned and the one that I just mentioned in terms of listening, is empathy. So being able to understand that patient, regardless of what their diagnosis is needing and requiring empathy. And that empathy is so fundamental to be able to develop a really good therapeutic relationship. So there's been some studies, and leaning on some of my other sort of knowledge and interest areas, where it might only take 21 seconds of a healthcare interaction to be able to show empathy. But if you only have a short amount of time, it's really important to be able to show that. But if you're with a patient for an hour and no empathy is displayed during that time, that certainly could influence the outcome of the patient, whether they're adherent, whether they come back and see you, and what their overall essentially benefit that they might sort of receive or achieve as a result of that healthcare and specifically sort of physiotherapy interaction. So I think it's really important that we show empathy and we remember the importance of common humanity and compassion. So that is, again, something that's part of our charter of physiotherapy, but it can be easy to forget at times when you're really busy and you're stressed, but it's really important for your patient for essentially them to be able to see you demonstrating that and feeling like you are hearing, caring about them, and that you've got a vested interest in terms of them getting their improvements or getting essentially benefit from any physiotherapy treatment.
Really, without empathy, without understanding the person and putting the person first, you really can't be very effective either. It's not just an optional add-on extra for the good clinicians who want to be a bit above average. You kind of don't know what's going on. Actually, how to demonstrate empathy starts with the skills of gathering the information and listening, but also what you said before about relating, perhaps individualizing their exercise program to what their interests are, is a form of empathy as well. It's not just putting yourself in their shoes and becoming, it's different from being emotionally attached to their problems. It's not sympathy. It's really tied into your first answer of listening skills and considering the humanity. We're getting philosophical, but it's really important. If you lack empathy, that's the first thing a person will tell you if they're complaining about a doctor or a physio is, oh, yeah, okay, they seem to know what they were talking about, but not a very good bedside manner. They're talking about empathy, aren't they?
They are, and their ability to sort of relate and I guess essentially appreciate the situation that a patient find themselves in, regardless of their diagnosis, and have empathy towards that and reflect that in the clinical approach throughout the assessment, treatment, management, further referral, whatever might be sort of necessary, education, all of that.
Such a good final message. So thanks a lot, Annemarie. That's some really good information. In the first episode, we've given everybody the places they can connect with and the resources they can look at. Can people connect with you in any other way? What if they're feeling like doing being involved in research as a clinician, or they want to have an early discussion about perhaps taking a research pathway, research training, PhD? Anybody? How can people connect with you?
You can certainly contact me through my email address, and Luke, I'd certainly give you my permission to include that in the show notes.
It's sitting there on your Monash page anyway, so I'll put your profile up there. Yeah.
That's probably the easiest way to connect with me.
Yeah. And as I said last time, if you found this important, interesting, helpful for your practice, go ahead and share it with other people who will find it helpful as well. And you can get on there and do a review if you like as well on all the podcast apps. That helps it get pushed up into other people's other people's feeds. All of that can be helpful. There's obviously no cost to you for this information. We put it out there because we're very interested in it. We know it will help people who are health professionals and their patients. And if you're finding this helpful, you can help it get to other people. And that's all we want from you. So look, thanks again, Annemarie. We'll have to do it another one in the future if you're keen. One of your other interests, music in therapy and non-pharmaceutical and non-medical interventions. It's a really interesting field. There's a lot more expertise you have. So maybe look out for that one in the future.
Sounds good. Thanks for having me, Luke. I really enjoyed our chats.
Fantastic. All right. And until next time, this is Annemarie and Luke wishing you all the very best with your studying professional development and lifelong learning.